Kenya inched towards the 5,000 mark after registering its highest number of infections in a single day. On the day the country marked 100 days of COVID-19, 260 new infections were recorded, with 2 more deaths, bringing the number of COVID-19 deaths to 123. Detailing the country's journey since the first case was reported back in March, Health Cabinet Secretary Mutahi Kagwe described the experience as, quote, bittersweet. Let's begin our broadcast with our very own Chemtai Going.
Having been appointed a Cabinet Secretary.
February 28th, Health Cabinet Secretary Mutahi Kagwe took his oath of office. Little did he know the task that awaited him. 2 weeks later,
The Ministry of Health has confirmed the first coronavirus case in Kenya.
And here the long and winding road to managing a potential crisis began. That saw learning in schools suspended indefinitely, churches closed, movement in 4 counties seized, order on wearing of masks in public places, and a dawn-to-dusk curfew imposed, among others, that has left the economy badly bruised.
Children talking about Yulem to wa corona. And on this 100th day, even as you enjoy that special meal, you know which one? The 1 sausage and 2 beers. Let us protect our loved ones by thinking of ourselves as watu wa corona.
The Health Cabinet Secretary acknowledged that the country was initially ill-prepared to deal with the virus.
We are to adapt and learn quickly, largely through trial, tribulations, and innovation that particularly impacted our quarantine system. We are aware that we inconvenienced many of you in the process, and for that, I would like to offer my apology with assurance that our systems are now much better and practical.
Some of the challenges that the country experienced over the 100 days included limited laboratories which were not configured to carry out a COVID test, shortage of personal protective equipment that put frontline health workers at the risk of contracting the virus, and a shortage of testing kits and reagents.
Coronavirus will be with us for a long time, and that it will, in all probability, eventually stretch our medical system just as it has globally. The more the government de-escalates measures, the greater the responsibility we will each have to assume.
The ministry says the country has come a long way. Bed capacity in COVID-19 isolation and treatment facilities have increased, and the country is now able to produce its own personal protective equipment, masks and sanitizers.
It has indeed been a journey, one which has familiarized us with such terms as contact tracing, quarantine, community spread, social distancing, and such words that we were not used to before.
Over time, the country's testing capacity has increased significantly. Since the first case was reported, 140,012 tests have been done. Statistics released by the ministry show that in March, 3,419 samples were tested. In April, the number rose significantly to 19,108. In May, 57,527 samples tested yielded 1,615 cases. And in June at day 20, samples tested have already reached 59,958.
COVID-19 has badly weakened our economy, cost us jobs, and impacted our business, particularly those in the informal sector. But we are forging on and continuing to balance economic concerns with the preservation of lives.
Today, marking the day the country recorded its highest number of confirmed cases in a single day at 260, pushing the caseload upwards to 4,738. 21 discharges were also recorded.
As I've stated before, I can get it. You can get it.
It's been 100 days of challenges and lessons for both Kenyans and the government. And going forward with the fact that the coronavirus is going nowhere, and as the country gears for the new normal, the power in flattening the curve now lies with the people. Chemtai Going, Citizen TV, Nairobi.